Hi, welcome to Baycliff Dental and Implant Surgery. My name is Dr. Salman, and this is Dentistry Cribs. First thing they'll come across is the reception. They report to reception, get their appointment sorted, and take a seat in the waiting area. The waiting area has been designed with specifically during COVID time to try and keep quite an area and spacious so people don't feel claustrophobic while sitting here. So this is the treatment coordinator room. The patient will sit down, go through the treatment planning of what they've come in for, and then the patient moves into the surgery room. The surgery has a capacity of 6 dental surgeries, and we've kept one room which is for the facial aesthetics, which we will show you towards the end. Moving into my room, so I'll show you the layout, come on in. The idea was to have the surgery layout in such a way that the patient is quite comfortable. It's quite a nice airy room. We've got a few things I had asked the designer, Amanda Jeffries, highly recommended. I don't want patients to come in here and feel nervous about treatment. An environment like this, it really sets the tone and helps them to get into a more relaxed mode as such. Television on the ceiling there, that sort of disconnects them from whatever we're doing. They concentrate on the entertainment and we continue with the work that we need to do. The orthodontic room, similar layout of the surgery room, so your chair, your television on there, on the screen there, your screen on the top on the ceiling. The chairs we went for, these I call DCI Edge, quite a decent piece of equipment. It's the reason for choosing this specific one was this is an ambidextrous chair, so if your dentist is left-handed or right-handed, you can simply just swap things around with regards to the suction, regards to the operating table, and it makes things a lot easier and the life of the dentist becomes a lot easier to work with. We've got an intraoral scanner. The whole idea of this scanner is historically we used to take dental impressions whereby you've got to mix all this material and it's sitting in the patient's mouth, the patient's gagging. It really isn't a good experience for ourselves or the patient involved. So what now we do is use this digital scanner, intraoral scanner, and once we've done the initial scan, it's literally a press of the button. This goes to the lab. The lab have got 3D printers. They print the models out for the patients, which eventually look like something along the lines of these. Good piece of kit, I definitely recommend it. It's the Intraoral Scanner, and we use this for our implant cases, our cosmetic bonding cases, teeth whitening and lighten, anything and everything is pretty much based around this. My preference is to use the equipment which is arguably one of the best out there. The kit that we use is off Nobel Biocare as well. There's a lot of implant systems out there, but I prefer the Nobel Biocare because there's a lot of research and it's evidence-based and it works pretty much every time. We use quite high-end equipment such as the Ostal Beacon, which is basically to measure the ISQ, the implant stability, and as soon as the implant has been placed, you can use this gadget to give you the reading of how stable your implant is and how well it is integrated with the bone structure. So again, the whole idea is to provide the patient with such a facility whereby it's very much foolproof and get the predictable results as you would want from a patient perspective. This next room I'm going to show you is the facial aesthetics room. I want to keep the feel and look of this room entirely different from the rest of the dental surgery, because when the patient is coming here or your clients are coming here for facial aesthetics, there's not dentistry per se, so we wanted to keep the look and feel of this room quite different and more of a spa kind of experience for the patient. A lot of people come to the dentist and they've had a terrible experience historically, and the whole idea is to try and improve their confidence, their whole outlook of dentistry as a whole. So we provide some intravenous sedation at the practice, where if patients are very nervous or they've had a terrible experience or just don't want to go through the dental experience again, they'd rather be sedated and not remember any of the treatment, we've got that service here. So we provide intravenous sedation quite regularly. Once the patient has had the treatment, we've got a place where they can relax and sit. I'll take you to the recovery room if you come with me. Once they've recovered, there's a dedicated nurse that stays with them throughout whilst they're in this room. Once they're recovered and they feel a bit more relaxed with everything, we bring the attendants in here explain to the post-op instruction on how to look after the patient, and then the patient would exit. Instead of going back into the waiting area where other patients are there, it's more suitable for the patient to accompanied by the recovery nurse, the attendant, and that is the exit that they will use to go out towards the car park, straight into the car, and off they go, instead of having to go back into the waiting area where they were seated initially. Another room that is one of my favorite rooms is the photo booth. I really like this room specifically because it gives us a bit of an exclusive environment where the patient can sit down and explain their whole journey and what is that their concerns were when initially they came in, how happy or unhappy they were with their smile before the treatment had started, and what have we met their expectations, and if there's any recommendation that they could make. The next room that I'm going to show you is the CT scanner. All of our patients specifically having dental implants are brought in here. This is the Cavo OP3D scanner. I chose this scanner specifically because it was quite in keeping with the innovative technology that we use for our dental implant placements. The good thing about this is it can take simple x-rays as well, with regards to whether you're doing a molar endo or doing some specific root canals. It also is particularly used for us doing our old surgical procedures, so wisdom teeth extractions. It gives you quite a holistic picture of what's going on for the patient. Once the CT scan is done, that helps us plan our dental implants as well, and it gives us some more predictable results that we can achieve by using a CT scanner. We got a lot of referral from other dental practices because it's not one of the common equipments that people have in their dental surgeries, so it's a good piece of kit that helps us with our flow of the patient, rather than patient coming here and having to go somewhere else for a scan. Everything is done in-house, from your intraoral scanners to your digital scanners to your CT scan. Everything has been provided into the practice itself. It's very CQC compliant, because what they want to see is when the patient comes in from one way, whether it's sedation or otherwise, there is actual flow from the practice from one end to the other, so the surgery has been set up in such a way that it's very CQC compliant. Hope you had a good trip today. Thank you very much for joining me at Baycliff Dental and Implant Surgery, and I'll show you out.